For the remainder of this training, we will utilize the physiological classification system that categorizes substances according to their effects on the body and brain. For Module 3, we discuss stimulants. Stimulants are so named because they stimulate the sympathetic nervous system, speeding up the messages that travel between the brain and the body. They typically increase survival functions of the nervous system, including alertness, circulation, respiration, blood pressure, appetite, and pupil dilation. This quickening often results in agitation, insomnia, and hyperactivity. Long-term or excessive use of stimulants may cause paranoia, aggression, GI disturbances, anxiety, seizures, and headaches. Some examples of stimulants include amphetamines or methamphetamines, MDMA or ecstasy, cocaine, and synthetic cathinones. Many amphetamines are Schedule II stimulants, which means that they have a high potential for abuse, though they are currently FDA approved for medical use. Amphetamines are sometimes legally prescribed to treat attention deficit hyperactivity disorder, or ADHD, and are available only through prescription. Illicit use of amphetamines is generally administered orally or injected, but may also be crystallized and smoked. Chronic abuse of amphetamines can produce psychosis, similar to schizophrenia, which is characterized by paranoia, skin picking, preoccupation with one's own thoughts, and auditory or visual hallucinations. In addition, violent and erratic behavior is frequently seen among chronic users of amphetamines. Physical effects of the amphetamine class may include increased blood pressure and pulse rates, insomnia, loss of appetite, and physical exhaustion. Methamphetamine, or meth, is a Schedule II substance with potent stimulant effects on the central nervous system. It has a high potential for abuse, although it currently does have an acceptable medical use. The one FDA-approved use is a medication called disoxin, which has very limited use in the treatment of obesity and attention deficit hyperactivity disorder. Meth is a highly addictive drug with potent central nervous system stimulant properties. It can be swallowed, snorted, injected, or smoked, and often users will increase dosage, frequency, or mode of administration to intensify the effects. Those who smoke or inject it report a brief, intense sensation or rush. Oral ingestion or snorting produces a long-lasting high instead of a rush, which reportedly can continue for as long as half a day. Chronic meth users can exhibit violent behavior, anxiety, confusion, insomnia, and psychotic features including paranoia, aggression, visual and auditory hallucinations, mood disturbances, and delusions. Such paranoia can result in homicidal or suicidal thoughts. Taking even small amounts of meth can result in increased wakefulness, increased physical activity, decreased appetite, rapid breathing and heart rate, irregular heartbeat, increased blood pressure, and hypothermia, or overheating. High doses can elevate body temperature to dangerous and sometimes lethal levels and cause convulsions and even cardiovascular collapse and death. Long-term use of meth may also cause extreme anorexia, memory loss, and severe dental problems. Ecstasy, or MDMA, acts as both a stimulant and a psychedelic, producing an energizing effect, distortions in time and perception, and enhanced enjoyment of physical sensations. As a Schedule I drug, it has high potential for abuse, and there are no medically accepted uses in the United States. Ecstasy is commonly known as a club drug, used by adolescents and young adults to change their perceptions of reality and to reduce inhibitions. It's known to promote feelings of euphoria, closeness, and sensuality. Administration mainly involves tablets being swallowed or crushed and snorted. MDMA is also available as a powder that can be smoked or snorted, although it's rarely injected. Use may cause experiences of confusion, anxiety, depression, paranoia, sleep problems, and craving. Beyond typical stimulant effects, MDMA may produce teeth grinding, muscle tension or cramps, tremors, nausea, faintness, chills, sweating, blurred vision, and severe dehydration. Chronic use of MDMA can produce damage to the serotonin system and interfere with the body's ability to regulate sleep and temperature. On occasions, this can lead to a sharp increase in body temperature, resulting in liver, kidney, and cardiovascular system failure, sometimes even death. There is some evidence that sustained use of MDMA could result in long-term or permanent damage to cognitive functioning, memory, or executive functioning. Khat is a plant that is chewed like tobacco and stored in the cheek for intermittent use. Khat leaves can be dried and smoked, made into tea, or sprinkled on food. The effects of khat resemble other stimulants such as cocaine, amphetamine, and methamphetamine. Ingestion of khat results in the loss of appetite, problems with breathing, increased heart rate, and blood pressure. Also, delusions, paranoia, hyperactivity, and hallucinations. Long-term use or higher dosage may result in liver damage, cardiac complications, violence, and suicidal depression. The two active ingredients, cathine and cathinone, are controlled under the Controlled Substances Act. Cathine is a Schedule IV stimulant, and cathinone is a Schedule I stimulant, both under the Controlled Substances Act. Both ingredients have a high potential for abuse, and neither have an acceptable medical use in the United States. Synthetic stimulants, often referred to as bath salts, are from the synthetic cathinone class and are abused for their desired effects such as euphoria and alertness. Bath salts are usually ingested by sniffing or snorting. They can also be taken orally, smoked, or put into a solution and injected into the veins. Cathinones, both natural and synthetic, mimic other stimulants and produce effects including quickened heart rate, increased blood pressure and body temperature, teeth grinding, and perspiration. Commonly reported psychological effects include confusion, acute psychosis, agitation, combativeness, aggression, violence, and self-destructive behavior. Bath salts and other synthetic cathinones are classified as Schedule I under a special classification under the Controlled Substances Act, namely the Synthetic Drug Abuse Prevention Act. Cocaine is an intense, euphoria-producing stimulant drug with strong addictive potential. It's classified by the DEA as a Schedule II substance, since it has a very high potential for abuse. However, despite more effective alternatives, cocaine remains approved by the FDA for medical use in very rare cases. Cocaine is usually distributed as a white crystalline powder which is cut with a variety of substances, the most common of which are sugars and local anesthetics. In contrast, cocaine base, or crack, looks like small, irregularly shaped chunks or rocks of a whitish solid. Modes of administration determine the intensity of cocaine's effects. Upon being injected or smoked, cocaine rapidly reaches the brain and results in intense euphoric effect known as a rush. The intensity of this euphoria is reduced when the drug is snorted or applied to other mucous membranes, such as the gums. Physiological effects of cocaine include increased blood pressure and heart rate, dilated pupils, insomnia, and a loss of appetite. Other effects include increased alertness and excitation, as well as restlessness, irritability, and anxiety. The crash that follows euphoria is characterized by a prolonged depression, excessive sleep, physical and mental exhaustion, and intense cravings. Chronic use may result in severe health consequences, including ischemic heart conditions, sudden cardiac arrest, convulsions, stroke, and death. Long-term oral inhalation can result in severe respiratory syndromes, and long-term nasal inhalation often erodes the upper nasal cavity and can result in perforations in the septum.